Go.
All right, so I am going to check my order, and I'm just gonna make sure I am at the right room and have the right patient. Got Mary Smith here, and then just check my order to make sure that I am gonna be doing the right thing before I go into the room. So I'm gonna gather up all of my supplies. So I know I'm gonna be doing a IV push on her. So I'm going to wash my hands. Knock, knock, knock. Hi, Mary. My name is Lane. I'm going to be your nurse today. I understand that you are having some nausea. So I'm here to give you some medication for that. Okay. All right. So I'm just going to provide for privacy here. And so since you have this PICC line, I'm not going to have to give you a shot or anything. We're just going to connect the medication right to your line, so you won't have to worry about getting another needle. And then I'm going to be getting something called Zofran just for your nausea. Do you have any questions about that medication or anything? Okay, all right, sounds good. So I'm just gonna gather up the supplies and make sure I get everything all set and get your medication all good to go, okay? And then we'll get that going for you, okay? All right, so I'm just gonna grab my chart here. I've got all of my supplies, so we're gonna be giving Mary ondansetron, which is Zofran, and I actually have that right here. So we're gonna be giving her 1.6 milliliters. So we've got it in 2 milliliters and 5 milligrams, and this is what we've got available. So I did my math here. In order to give her 4 milligrams, we're going to give her 1.6 mils of this medicine through IV push. Okay, and I've got this labeled 1.6 mils. And actually I don't have it labeled yet, but I'm gonna label it. So I've got some tape right here. And I just wanna make sure I check the expiration date. I've checked in my Betty book to make sure that her allergies, she's got an allergy here to morphine, but we're not giving her morphine today, and she doesn't have any allergies to this medication. And I also checked to make sure that I am able to, this is a correct dose for her, and this 4 milligram dose can be given undiluted, so we're going to do that. And also it says in here that we can give it over 2 to 5 minutes. Okay. All right, so I've also got some saline flushes, so I'm going to be flushing her as well. So I am going to get this dose accurate first here. I've got a pre-filled syringe, and I need to make sure that it's at 1.6 mils. So just make sure that there's no bubbles in it or anything. Here, I'm just gonna waste this. So back on here. All right. So I've got it here at 1.6 mils, and there'll be no bubbles in here.
Okay.
All right, so then I'm going to just check this the 5 rights 3 times to make sure that I've got the correct thing. So I'm just going to come over here and just verify that I've got the right patient first. Mary, could you just verify your name and date of birth for me? And she's got Mary Smith, 5/18 of 1963. I've got Mary Smith here, 5/18 of 1963. Okay. All right. So I'm going to just hold this up next to here. So I know that I need to give 1.6 milliliters of this drug in the ondansetron, and we're going to be giving this IV push, and it's every 4 hours as needed, and she has not gotten this medication yet. So I've got Mary Smith here, and we're going to be giving her ondansetron hydrochloride, and 2 mils, 5 milligrams is the amount that we have available. So I'm going to be giving her 1.6 mils, and that'll be IV push, and it's the correct time. She hasn't gotten this medication yet. And then one more time here, I've got Mary Smith, 5/18 of 1963, and I've got ondansetron hydrochloride, 1.6 mils, and we're going to be giving that IV push, and it is every 4 hours as needed for her nausea, and she has not gotten this medication yet. Okay? Alright, so she's good to go. So I'm going to grab some alcohol pads. Okay, alright, Mary, now I'm going to just come over here and I'm going to set this stuff down right next to you, since you're okay with that, and she doesn't really need anybody else here with her. She's not feeling too nervous or flailing around, so I'm able to put the stuff closer to her. Okay? Alright, so I'm just going to wash my hands up again and put some gloves on. Okay, now Mary, I'm just going to check your site here just to make sure you're not having any issues, and I don't see any swelling or any redness or anything like that. There's no drainage, so I'm just gonna palpate. Do you feel any pain there, Mary? Are you doing okay? And she says that she is, so we're gonna be able to use her PICC line. Okay, so I'm gonna be giving you a saline flush here first, just to clean your line out. So take the cap off and clean this up. 15 seconds. Okay, all right. Now get your first flush here. Just gonna pull back and bubbles out. All right, and then unclamp her line. Let's pull back a little bit and make sure that I get some blood return, and I do. All right, and so I'm just gonna flush this line. Did you push this all the way through?
I did. Yeah. Going on the bed.
Where did it go on the wall?
Probably on the bed.
I know, I don't know.
I think all mine did too.
Yeah, where's the supposed to go?
I'll clean that up.
Yeah, okay. Alright. Alright, so then, did you have feel any pain with that, Mary? Okay, and she doesn't feel any pain. Okay, good. Alright, so then, get rid of that. Okay. Alright, then I'm going to clean for 15 seconds in between each one. Alright, so now that I've given you your flush, I'll give you your meds. Alright, so then with this 1.6 mil of Zofran, we're just going to give this over 2 to 5 minutes, which is what it said in the Betty book for 4 milligrams, which is what is recommended. Okay, so we'll say for time that was 2 to 5 minutes. Okay. come in here?
No, you're good.
All right, so 15 more seconds on that. All right, and then, so this would also, the first flush after the medication, we want to make sure that we give over 2 to 5 minutes as well. And then, you know, just all the while kind of thinking about your patient in general and making sure that they, you know, are still in need of this central line, making sure that they're doing okay. Mary has just had a surgery, so she does need IV antibiotics long term for a little bit, so it's beneficial for her to have this central line. So, okay, all right, and then I'm gonna wash in between.
Yep.
Yeah. All right, and then for this last flush, let's get this water all sailing out. All right, and then since it's a pick, the last one we're gonna pulse through just to make sure we get her all cleaned out. About 1 ml per pulse flush. Okay, all right. So then I'm gonna pop this top back on her and lock this back up. You doing okay, Mary? Okay, good. All right. So I'm just gonna throw away all my supplies in this trash. All right, and then I'm gonna take off my gloves and wash my hands up. And then just let Mary know, so, you know, there are a few side effects. So if you do start to feel a little bit dizzy or constipated, please let us know if you feel anything out of the ordinary. And then if you need help going to the bathroom, let us know. Just here's your call light, so don't go by yourself. Just make sure that she's comfortable and that she has everything that she needs. And then going to just document everything in her chart, and that's it.